So welcome everybody. We are Lutza and Mariana, and we're going to be your 2022 ESSPD conference podcast hosts. The objective of this podcast is to provide you with a glimpse of what is to come in our Congress. So please stay tuned.
And our very first presenter is Professor Lars Mehlum, who is an MD PhD and the founding director of the National Center for Suicide Research and Prevention at the Institute of Clinical Medicine at the University of Oslo in Norway. He's also the past president of the International Association for Suicide Prevention, the past president of the International Academy of Suicide Research, and of the European Society for Study of Personality Disorders. With his research group, he focuses on the clinical course of suicidal and self-harming behaviors with respect to etiological and prognostic factors, such as stressors and negative life events, personality traits and disorders, major psychiatric illness, and the effectiveness of interventions, among them dialectical behavior therapy. So Professor Mehlum, we are delighted to have you here and also honored. Thank you very much for your presence.
We would like to start this podcast with asking you for your opinion of what do you think about our conference theme? It is Change for a Better Future, Perspectives Beyond Symptoms.
Well, for one thing, I think it's a very optimistic and a very salutogenic approach. So I like it. And I think we need to think about not only how to cure illness, but also how to facilitate self-healing and natural capacities people have to grow and to help themselves. So I like it. And I think also what we are doing is not only for the sake of individuals, but also for the common good, for the society. Because I think personality disorders has a lot to do with identity, right? It has to do who we are. And that's not only an individual thing, it's actually also a cultural and a social factor to be counted with. So I like it very much.
Thank you.
And why did you decide to become a researcher, and what got you interested in your field of research back in the day?
Back in the day, yeah. Well, I would have loved to say that was a thing I had planned from I was a child. Perhaps I actually had some talents when I was a child and as I grew older, but it wasn't a very, very calculated thing. It was actually the professor on the clinical department where I was working when I was just in my second year as a resident, who invited me to become part of a study on people with borderline personality disorder. And curious as I am and always eager to learn, I've been so curious in all my life. I was too curious to say no. And also I was honored and I was a little, well, astonished that I was invited. So I said yes. I always say yes if there's something to be learned or to be had. So I said yes. And from then on, I've always done research either as a main part of my work or part-time. So in the first years, I would do research, on the spare time when a lot of clinicians, young clinicians are doing that, which was a lot of work, but also very pleasurable. So from then on, I did research. Yeah.
Staying in this topic, do you have any advice for young researchers beginning in your field?
Well, I would say yes. If you are asked to do something or to be part of something or to take part, do say yes. If this is something that you at least have a certain interest in doing, because people like me or senior researchers will look for people who are willing and interested and curious. That's a very important quality of young researchers. So And of course, there is always this this aspect of grabbing the opportunities you can get. That's one thing. And I would also say, if you are going to do research, you should look for what interests you. For example, if you're doing clinical research, look for it in your patients. What is intriguing you? What is it you can't figure out and that you would love to learn more about? And of course, read stuff, because there are so much interesting now available. I mean, under your fingertip, you can get all the knowledge in the world. So it's wonderful. And when I was a child, I would read the dictionary. And I'm pretty sure people think that would be crazy now, but I was so curious, so I wanted to learn as much as I could. And so now you can, of course, don't have to read the dictionary. You can read a lot of stuff on the web, for example.
Thank you.
And which part of your research are you the most passionate about?
I have to say, I'm doing both epidemiological and also basic research, but mostly it would be the clinical research, where I am seeing patients and going back and forth from the patient and to the research. So that's the reason why I've, even though I'm a full professor of psychiatry, I've maintained a practice to this day. So even today, I've seen several patients, and must say that that is my main source of delight when it comes to research, looking for what's the unique and special with this case and this patient in my interaction with that human being, and what would be patterns that would be more common and that could be generalizable knowledge that we could use, either to study what are the reasons why we are the way we are, or what would be things that we can actually change, for example, in the interaction with patients. So psychotherapy research is my favorite. It's also the most complicated, but it is very pleasurable, I think.
And where do you turn for scientific inspiration?
Where do I
turn for scientific inspiration? Where do you find it?
I would say, of course, other than with my patients, I would say conferences would be very important. And why? Well, because, you know, when you go there, people would really prepare something very special, something they possibly have used a lifetime to distill and to share with the colleagues. And you have this unique opportunity to interact and to ask questions and to meet with people, because, you know, two heads think more or better than one. And many brains together, I think, can solve even very complex questions. So I'm an optimist when it comes to the prospects of gaining knowledge. And I think even though we are dealing with the most complicated probably of all, namely the brain, I think we have learned so much over my lifetime, at least. I mean, we, let me just mention one thing. About a little bit more than a decade, perhaps 15 years ago, we didn't have one single psychosocial intervention that we knew would be effective in treating and reducing self-harm and suicidal behavior in adolescents. We didn't have one. Now we have several. That just happened within the last 1 or 2 decades, which is enormously important. So, and this is happening more and more rapidly now. So I think that that's because we are better to collaborate and to share and disseminate, for example, through conferences.
Thank you.
What do you think should be the new perspectives that researchers and clinicians should take when treating or researching personality disorders?
Well, I think there is a metaphor where we have used this picture of if you spill a little ink on the table and then you have another spill on the other side and then a third one, and they will then gradually grow, and in the beginning they just approach each other, but when they finally meet, they merge very rapidly, right? They become one ink blot. And that's the same with the different approaches to knowledge about personality disorders and their treatment, from neuroscience, psychosocial and psychological approaches, and from social contexts and approaches. I think we have learned and we have grown more and more together. And now when they are now finally merging, I think it has been speeding up. So I couldn't answer one approach. I think we need to have a mixed methods approach, and I think we need to have several, for example, to have only psychotherapeutic methodological approaches wouldn't be right today. I think we always should mix with other approaches so that we can get more out of the resources and learn more. So that's why, at least in my center, I've established a new group where we are also using genetic and biomarkers research. We are just in the beginning, but well, perhaps we were latecomers, but we have to do this now. Even though we didn't do much of it before, we are doing more of it now.
It's very interesting. Thank you.
Great. So we're moving forward to the second part of this podcast, where we would really like to know who is the person behind the researcher. So I'm going to start with my first question. That is, have there been small coincidences in your life that appear to have played a major role in your life?
Yeah, I would say that when my, I would say, for example, this example, when this professor would ask me to become a part of this research, that would play a major role. And that was a turning point in my life. But there have been other occasions as well. And I think that, well, for example, let's take one thing I learned a lot from. A few years ago, I was taken ill. I had never been ill in my life before, but I nearly died, and it was dramatic. But I felt that that was also something that made me grow, and that showed me something about both my patients, my collaborators, my family, and my life. So I think it changed something for me. I learned perhaps to not be overly ambitious, and to make things in just about the right time, for example. That would be one thing. I also learned that everything is limited. You have to count your days.
Okay.
Well, the next question might be related. What's the one thing you are the most grateful about?
That would be my children. That's what I'm most grateful about. that was also the 3 greatest days in my life. It was also when I got married, but that one day I would have loved to experience once more, because that was probably the day in my life when I was most happy. But when my children came to life, I think that was the most important, and still is, because I would, as any parent, of course, I would never have been without them. But I can vividly remember each of those 3 days.
And I'm staying in this line as well with the next question, which is, what makes your heart beat faster?
I think it is. If it's about important things in my life, I think it is when I feel connected to other people, and then I feel something important is happening. It could be in a therapy, but it could also be in a private situation, or with a colleague, or it could be with my family. And that would probably, I think, and I'm a pretty phlegmatic person. I'm not a very sanguinic person, but when I am more, my heart beats, it's about people, probably. It's not under the microscope. It would be something interacting with other people, something inspiring or important.
Okay.
And what has been the most inspiring influence in your life?
I've been fortunate enough to have, when I was younger, I had 2 or 3 really good bosses. Perhaps they were not as streamlined or as modern as today, where, you know, when you are head of a center like me with nearly 40 employees, you have to you have to play by the rule, and you have to be pretty updated. But they were not like that. They were very old-fashioned, but they were very knowledgeable, and they were good models. And so those would be important role models. But the most important role model in my life, that would be my maternal grandfather. He is, of course, long gone now, but he was an intellectual. But first and foremost, he was a man who had high ideals and lived by them. So he would do a lot of good things to other people. And very cultivated, did a lot of things. And he was a blind man. He was born blind, but he was the head of the family, even though he was always where everyone would go to get support, help, guidance, whatever it was. He was the man to go to, because he never was disabled. He was a very resourceful man. So that was my big role model, an inspiring role model. If he could do that back in the days, he would have been 120 years old if he had lived now. And at that time, to be born blind was very difficult. But he never let that incapacitate him. And then I've told myself, I can do the same.
Very inspiring, indeed. I have one last question. So if you were to be able to travel back in time to relive some special moments of your life, which moment or moments would you choose?
I think actually, I've been thinking about that question from time to time. But I don't think that way. I'm happy about today. I am so grateful for all of the things that I've had in my life. and I'm still alive, and I'm very young in my head. So I think I'm very much occupied by being using the day. So every day for me is the best day, I think. But actually, you two, I remember quite vividly when we were together in Switzerland, and you were part of the first summer school, right, of the ESSPD in Créberard. And I remember so much what a good time we had, and that would be examples of things I would have absolutely have relived. Wonderful time, and that is very inspiring for me.
We would agree with you.
Absolutely, it's really heartwarming. And we would love to continue with the questions, but we have to try to find closure now. And we thank you very much for your time. And we are looking forward to hearing more from you at the conference.
Thank you, and thank you for having me.
Thank you very much.
Goodbye.
Bye.